Independent Study Mentorship Program. My teacher's name is Miss Robin Holk, and my mentor's name is Dr. Larry Fleming. Some of the information in this presentation comes from outside sources and will be documented appropriately at the end of my presentation. So a little bit about the Independent Study Mentorship Program. It's a class for juniors and seniors where we get to shadow our mentors that are in the field that we're interested in. So it's a hands-on experience, and it's just a way of figuring out if the field is something that we actually want to look into. So I chose veterinary medicine, so I'm shadow Dr. Larry Fleming. A little bit about veterinary medicine. You probably know that veterinary medicine is the field of medicine dedicated to taking care of animals and their health and whenever they get hurt. There are different types of veterinary medicine, such as exotic animal veterinary medicine and livestock and small animal, which is the kind that I'm interested in. Also about veterinary medicine, it originated in larger parts of Africa and Asia, mainly for livestock purposes. So in early societies, whenever they were first domesticating animals, eventually they got sick and they needed someone to take care of them. To become a veterinarian, you have to attend 4 years of undergraduate college and 4 years of graduate college. And a statistic that I thought was really interesting is that approximately 70% of veterinary school graduates are women. So I hope to be one of them. Why did I choose small animal veterinary medicine? I've always been interested in becoming a vet ever since before I could spell veterinarian. And I grew up in a neighborhood that's in a heavily wooded area over there by Armand Bayou, so I was always getting injured squirrels and injured birds. And actually last year there was a hawk that got shot in the wing, and I convinced my dad to pick it up with gloves on and goggles, and we brought it to a rehabilitation center. And though bringing the animals to a rehabilitation center was satisfying, knowing that they were with people that can help them, I've always wanted to be the person who could bring them back to health. So, things about me other than that I want to be a vet when I grow up. I play a lot of instruments. I'm really into music. I play the guitar, the piano, and I'm learning the banjo. And I also play the violin in the orchestra. I'm in the chamber orchestra here at Clear Falls. I'm also in National Honor Society, and I build model rockets with my team, and we've gone to a national competition for the last 4 years. A couple of years ago, we won 6th place in the nation. So that's what I like to do besides look at cute animals all day, I guess. A little bit about my mentor, Dr. Larry Fleming. He graduated from the University of Illinois in 1987 and I guess got tired of the snow and wanted to enjoy, or rather endure, our southern weather, and opened Marina Bay Animal Hospital in 1993. And the practice has since grown and now has, I think, 5 or 6 veterinarians working there. I never see them all there at once, but I know that Dr. Kim Fleming, who's actually his wife, also works there. So here, I don't know if you guys saw them whenever you were looking over there, but these are my research summaries. In the ISM program, we're required to do 4 research summaries that kind of lead up to our end product and different, I guess, increments of how detailed they are. So my first one was just about veterinary medicine and what it takes to become a vet and where veterinary medicine originated. My second one was about congenital musculoskeletal disorders, which is what I've been studying mainly. And my last 2 were about specific musculoskeletal congenital disorders like craniomandibular osteopathy and hip dysplasia, which my whole project is over. Hip dysplasia, not the one, because the other one's not very common. I'm sure you guys know. We are also required to complete a case study, and so mine was over Dr. Larry's dog, Rusty, who is a golden retriever and had 2 different hip dysplasia surgeries. So I just did my case study over him and the surgeries that were done on his hips. In ISM, we pick goals, like I was talking about the research summaries that are in different increments of detail to lead up to our final presentation. And my first goal was just about congenital disorders in the broad, like malabsorption and things like that, not necessarily musculoskeletal. And my second goal was about congenital musculoskeletal disorders. And my third goal is about different surgeries and the outcomes of them with treating hip dysplasia and other musculoskeletal congenital disorders. So here are some pictures taken from my mentorship at Marina Bay Animal Hospital. I normally go on Tuesdays because that's my only free day, and I try to go for 2 or more hours every week. I shadow Dr. Larry, so whenever I get there, at that time he's normally going to appointments, and so I go in those with him, and we see the patients, and I take notes about their conditions. I sometimes make my own hypotheses about what it is that they have, because it seems that a lot of the animals that come in have kind of the same thing over and over again, in more common things like allergies and that type of thing. And whenever Dr. Larry takes slides of different things from the pets, I look at them and I usually draw them in my notebook of things, and I go home and I research the specific bacterias and things like that. And the other veterinarians and technicians at Marina Bay Animal Hospital are very willing to help me, and whenever I ask them questions, they're always enthusiastic about their answers, and you can tell they really like their jobs. Now to get to my product. So this is what I worked on, or what my whole mentorship so far has been leading up to. I created an algorithm for the diagnosis and treatment of hip dysplasia. This is a really condensed version of it, but I'm going to explain it in more depth anyway. Okay, I apologize again. I think it'll work on this, so at least I hope it will. So my final product is the algorithm you see before you. I'm going to, I guess, explain it in more depth and musculoskeletal congenital disorders. So congenital disorders of the musculoskeletal system are disorders that are either prevalent or inevitable from birth. They're hereditary, and common musculoskeletal congenital disorders consist of laxity of different joints. So that would be your hip dysplasia and elbow dysplasia, but there are others like craniomandibular osteopathy, which I talked about before. Normally people try to, I guess, avoid musculoskeletal congenital disorders by not breeding the dogs or cats with them. But even if the animal does not have the disorder, they can still carry it, and they still sometimes have offspring with the disorder. So, in other words, a dog without hip dysplasia could still have puppies with hip dysplasia, and there's not much you can do about that besides what I'm about to explain. Alright, so hip dysplasia is the luxation of the femoral head from the acetabulum, and it causes severe pain. So basically the two bones are rubbing together, and it's common in Labrador retrievers and German shepherds, larger breed dogs like them, but it's not limited to those animals. In an animal that hip dysplasia is not congenital to, that it's not common, other causes of hip dysplasia include old age, just general wear and tear, excessive exercise during the growth periods. If the animal's overweight, of course, there's extra stress on the joints, and it could cause them to get hip dysplasia. Or abnormal exercise habits, which would be like, I have a dog, a little rat terrier, and he likes to stand on his hind legs and jump up and down, and that's not good for his hips and could eventually cause hip dysplasia, though we can't get him to stop because apparently he's from the circus. So symptoms of hip dysplasia include lameness of the hips, abnormal gait referred to as bunny hopping, difficulty rising from sitting or down positions, and refusal to jump on and off surfaces. Those are just observable warning signs and would lead you to take other steps to diagnose the disorder. So if you see those in your animal, then you would take them to the vet and get these next things. Like the Ortolani test, which is where you apply a small amount of pressure on the top of the hips, like my right hand is doing in this, and you go under one of the dog's legs and bend its knee like the dog is squatting, and rotate the leg out. And if you feel the pop of the femoral head and the acetabulum, then it would be a good idea to take radiographic images of the hip and see if it does have hip dysplasia. So in these pictures, I performed the Ortolani test on my 5-year-old Labrador Retriever, and normally you would do the Ortolani test on a dog while it's on its side. However, my dog doesn't lay down unless he's sleeping, and I had to feed him peanut butter just to get him to stand still long enough for me to do that. So on my algorithm, one of the first reason that the animal has hip dysplasia would be that it's overweight. And so the hip dysplasia is usually secondary to it being overweight. And if the animal already had hip dysplasia, then it could just worsen the condition. So you're not going to want to do surgery just right off the bat because it's expensive. So normally we'll do like physical therapy and put the dog on a diet and see if the hip dysplasia gets a little better before taking other precautions. Next on the algorithm is if there is a dog that is 1 year of age or younger and has minimal to no arthritis. A common fix for this would be to do the triple pelvic osteotomy, which consists of 2 through cuts to the pelvis and 1 through cut to the ilial body. And then the hip has a plate in it, and it keeps it rotated. So the coxofemoral head is then, I guess, rotated, and the femoral head can't pop out of it once the plate is there. It has a 90% success rate, and it's of moderate cost, so I guess it's moderately used because of this. And the only problem with it is that it may lead to arthritis. And the good thing about this surgery is that it maintains the general anatomy of the hip, so it's not completely different than the coxofemoral joint was before. If there's a smaller dog that just completely should not have the total hip replacement done, that's the most expensive one. So if that's like out of the question and the owner needs a cheaper fix, this works. This is very effective. And it's the femoral head and neck ostectomy, which consists of completely removing the femoral head and the femoral neck. And sometimes a veterinarian will pull muscle tissues between the 2 bones so that they're not rubbing up against each other, causing the original problem, because that would hurt. The good thing about this surgery is that it's the least costly. The bad thing is it kind of destroys the anatomy of the joint, and it's kind of completely different after. But it's generally successful, so in younger dogs it's used a lot. So in a mature dog, or where the skeleton is mature, and the dog is of good health and generally like other aspects and doesn't have arthritis or anything like that, a total hip replacement is possible, which is just like in humans. They put the fake hip, which are metal or sometimes like ceramic or plastic, it kind of depends. This is the most expensive treatment though, and so I guess it depends on the owner whether they want to do that or not. The good thing about this surgery is that it keeps the anatomic relationship of the hip intact pretty much completely, just a healthy version of the joint. And sometimes the mechanical piece that goes in will get worn down, and then they have to do the hip replacement again, and that's, again, very expensive, so doing 2 of those is probably not the greatest idea. So my hopes for my product, I guess, would be that it could be created into a brochure to be given to patients. Now, if it were a brochure to be given to patients, it would have prices on there so they could see, I guess, what it is. If they don't take the proper precautions, what it might lead to, they might end up having to pay a whole lot of money to get a total hip replacement, or if they go ahead and put the dog on a physical therapy and diet treatment, then it might not get that far. Another way, I guess, my algorithm could be used would be in a poster form in a vet's office, just as a reference. So that one's very condensed, but if it were used for something bigger like that, than that, I would include more information as well as prices and things like that. And so here are just the sources I used for my project, as well as the guidance of my mentor, Dr. Fleming. I would like to thank my mentor, Dr. Fleming, for all the hours you spent teaching me all this and more, a lot more about other subjects, and my teacher, Miss Robin Holk, both of my parents, my brother, and my best friend's mom for dragging me to and from the vet because I'm too slow to get my driver's license. And now if you have any questions, I'll take them. Okay, thank you.
Did you get a positive ortholani test on your dog?
No, I didn't. He's very healthy and I'm glad. I was like, Mom, congratulations, you don't have to spend money.
Don't do that.
I don't want to know.
Did you manage to get a positive one with Dr. Larry?
No.
Okay.
I have not seen a positive ortholani test so far.
Don't
I'm
feel
not
bad,
sure I
it takes a
want
while
to.
to
I'm not very good at them either. That's why I ask.
I don't think we have any.
No.
We just don't see.
What about craniomandibular osteopathy? Did you see a case while you've been with us?
No, I haven't. I would like to.
Somebody did. I didn't, but I heard someone talking about it.
Really? I
Might
might like to see
have been
that.
Dr. Lucy. I might be imagining it, but I thought I heard someone talking about it not so long ago.
Yeah, that's very interesting. I'd like to see it if there is a patient.
They're interesting when you see them.
Yeah. That's why I didn't do my whole project over it, because it's
No,
a
you wouldn't
really
have had many
rare
cases.
thing.
Yeah.
Okay.